So now we'll talk about the specific services and supports, and I will explain some examples. Like Ben said earlier, we have these 4 different areas: affordable health insurance, medical care coordination, disability rights and discrimination, and home and community-based services. The first one that we'll talk about is affordable health insurance. Health insurance can be so complicated. It's complicated for people who don't have any chronic diseases or chronic illnesses, which means for people like us, it's that much more complicated. Chronically ill people may unintentionally miss out on affordable health insurance options because the system is so complicated, and we do not want that to happen to you. This is where Canary Corps comes in to help bridge that gap and get you access to locally informed health insurance help. That comes in the form of local enrollment assistance sites. They're completely free. They can help you understand all of the options available to you for affordable health insurance, even going so far as plugging in your prescriptions into the computer to calculate cost estimates and figure out the right plan for you, and helping you actually apply and access that affordable coverage and continue to have that affordable coverage. A real life example of a person with ME accessing this kind of support. So this person with ME was about to lose their health insurance coverage because they could not continue working as their symptoms worsened. They were referred to their local health insurance enrollment site for free and learned about a disability health insurance program offered through the state. The local enrollment assistance site helped them fill out the application, and several months later, they got approved. From that point forward, they had no more bills from the ER or the hospital. All of their drugs were covered in full. The copays for doctors and therapies went down to $2 with no deductible, and they could finally focus their limited funds on other basic needs like paying rent, groceries, and medical costs not covered by insurance. This program was life-changing for them, and we want to make sure that you are not missing out on a program like this. But each state varies so much in what they have to offer, which is why Canary Corps will connect you to a local office in your region to advise you on the options in your state. So the second area, medical care coordination. We all know it can be nearly impossible to keep up with coordinating all the moving pieces of our medical care, especially when energy limitations are involved. When this happens, it impacts our care and ability to manage our symptoms and diseases. The possibly good news is this is a common problem in the healthcare system, and that actually means there is some help available for it. That comes in the form of medical care coordination. They can help manage the administrative burden of medical needs by coordinating things like transportation, prescription pickup or delivery, communication between multiple providers at different offices or in different systems, helping you fill out applications for assistance, accessing community resources, and quite a bit more depending on the type of care coordination and where it comes from. Speaking of which, where can you find this kind of help? You can find it at a variety of different places. You can sometimes find it at medical provider offices if they have the staffing capacity. You can often find it directly from your health insurance company, and then you can also find it in community organizations. Oh, whoops, I'm going to go back to that slide. So one last note on this. Care coordination support is often available, but providers forget to refer us to them, or they don't know where to refer us to. They often forget that care coordination is available through insurance companies. They don't have enough time with us during appointments. So this is why Canary Corps prioritized it as one of our 4 areas. We want to make sure that you get across this bridge to access the care coordination that you need, and that's what Canary Corps will help you do from whichever location makes sense for you, medical provider, through your health insurance, or community organizations. So now to the third category. We are talking about centers for independent living. So many of us know that adapting and embracing a new normal with chronic illness or disability can be so challenging. I myself have definitely experienced that. Um, it can be a lengthy and difficult process, and there's a lot of logistical hurdles. So, where do you go to get help with the various aspects of adapting to this new normal? This is where your local centers for independent living can come in. These offices offer peer support, skills training, advocacy, and referrals to local services to help you figure out how to live in your new normal. If you remember from the historical context part of our presentation, we talked about the independent living movement that was started in Berkeley, California with Ed Roberts. This is part of that, the Centers for Independent Living. So examples of this, if your ME chronic illness is making it hard to drive or you need accessible transportation, your local Center for Independent Living can help with that. If your illness or disability is making it difficult to keep up at work, they can help you understand your options, your right to request accommodations, or maybe counsel you on what options might exist for disability benefits. And then finally, and probably the most important thing that Centers for Independent Living do, is that if your illness or disability makes you at risk of going to a nursing facility, but you want to get care at home instead, they can help you understand your right to get care at home and how to access that kind of support in your area. Okay, let's talk about an example. So, a person with ME was referred to their local CIL, Center for Independent Living, because their ME was worsening and they couldn't continue working anymore. One of the local Center for Independent Living staff helped them process through the emotional and just life consequences of needing to stop working due to worsening symptoms. They then explained the options for disability benefits and over a series of appointments broken up to work with their ME symptoms, walked them through the entire SSDI application process, helping them fill out the paperwork and submitting it. This is an example of help that Centers for Independent Living can offer, but the offices do vary by region. So it's not that every single Center for Independent Living will be able to offer that. That's why Canary Corps is going to help you find your local office and figure out how they might be able to help you. Okay, the last section, which I very briefly touched on earlier, is home and community-based services through Medicaid. So our chronic illnesses and disabilities can impact our ability to keep up with daily life needs and tasks, like I mentioned earlier, especially with energy limiting chronic illnesses. And pacing can be such an important tool to help us manage our energy limitations. But how do you do that if basic life tasks like laundry and going to the grocery store exceed your energy limit on a regular basis? You have to meet those needs as well. The answer to this is home and community-based services. These services can provide you with support for those tasks so that you can prioritize using your energy the way that you choose. So, what do these services actually do? And really quick, I just want to note that I've abbreviated home and community-based services up at the top, HCBS. That's a common acronym used when talking about this. And the term home aids also refers to this. So back to the services. They help with things like laundry, and that includes help doing the laundry, taking the dirty laundry down the stairs if that's necessary in your living space to start the laundry, start to finish doing the laundry, then folding the clean clothes and putting them away. Going to the grocery store, putting away groceries at home, then preparing the meals, and then washing the dishes after, start to finish. Picking up prescriptions, filling medication boxes, if that's something you want and need, it's not required. Like housekeeping, including making the bed and putting on clean sheets. I know I struggle so much with putting on sheets. It would wipe me out for like half a day. And then maintaining a humidifier or air filter, which can be really helpful for people who have mast cell activation syndrome or other environmental sensitivities. Providing non-medical transportations for outings you choose, like visiting a friend, going to the store, etc. Help with bathing, and that can also be in the form of paying for accessibility modifications for your bathroom to help you be more independent while bathing, if that's something you want. Help with dressing, including putting on and taking off compression garments, because that feels like a workout all on its own. Help with mobility aids. So this could look like pushing you in a wheelchair if that's what you want, lifting the wheelchair out of the car if it's heavy, helping you up curbs or through doorways if you prefer to push yourself, and then maintaining and plugging in equipment, which is important to maintain your mobility aid. And then one of the things that I enjoy the most, which is support being out in the community. So say you want to go to the farmer's market, but you're worried that like the temperature, the noise, or other factors might mean you might need to leave right away and you won't be well enough to get home on your own. You can have support with you to make that outing possible. And help filling medication boxes, which I noted earlier. Whoops. Oh yeah, that's what I meant to do. Okay. So let's talk about an example. So an example of a person with ME who accessed home and community-based services. So this person struggled with daily life tasks. They were overdoing it just to keep up with basic needs, something familiar to a lot of us in the community, I think. And they finally applied for home aids through Medicaid. It was really challenging to do it. There was a lot of stigma to work through, the dynamic disability thing, and just the application process was challenging. They were finally approved, and they got a budget from the state of almost $3,000 per month through a company that manages the funds and payroll to pay for caregivers, including their own family members, to help with laundry, meal prep, groceries, prescription pickup, bathing safely, putting on compression stockings, and so many other tasks. Now this person with ME is actually able to pace themselves because they aren't having to overexert just to keep up with daily needs. I think I mentioned this previously, but these services can go by a lot of different names, which can cause confusion in our community. So home and community-based services, long-term care Medicaid, Medicaid waiver, and home aids, all referring to this same program that we've been talking about. So, in case you haven't figured it out now, I was the example person with ME for all of these different areas.
Could you repeat that list again of the names it could be called?
Oh, yeah, sure. Let me back up. Home and community-based services at the top of the slide, which is also abbreviated HCBS. Long-term care Medicaid. Medicaid waiver services. That waiver term is really common because that's how they provide these services. And then home aids is the term I see most commonly used in our community because it's on the How to Get On WordPress site.